Mucopolysaccharidoses, or MPS, is a family of conditions with many different symptoms. But in this video, we will explore how MPS causes some bones to grow smaller and connective tissues to grow larger. To understand MPS, let's review how our cells work. Our cells build all types of molecules for regular, day-to-day use, building molecules from smaller pieces. When molecules become old, damaged, or unneeded, they are broken down by the lysosomes, the recycling centers of the cell. In the lysosome, tiny molecular machines, called enzymes, break down the old molecules into smaller pieces so that they can be sent off to be recycled or removed from the cell. Our cells know how to do this by reading DNA, our body's instruction manual. Individual instructions are called genes. Some genes are for making molecules, and others are for breaking them down. One of these types of molecules is called glycosaminoglycans, or GAGs. GAGs used to be called mucopolysaccharides, which is where the disease MPS got its name. GAGs are a common molecule in the body and do many important jobs, including building our connective tissue. When GAGs are no longer needed, they are broken down by the GAG enzymes in the lysosomes. In MPS, the genes for the GAG enzymes are mutated, and the enzymes don't work as well as they should. GAGs aren't broken down as much as they should be, and don't get removed from the lysosomes. Over time, more and more GAGs build up, until the lysosome stops working. With fewer working recycling centers, damage starts occurring throughout the cell. This affects each part of the body differently, especially the areas that use GAGs to grow, like the bones and connective tissues. Connective tissue is found between all parts of the body, connecting them all together. It is living tissue made up of cells. It includes tendons, ligaments, joints, cartilage, and also lines our bones and nerves. Connective tissue is one of the areas of the body that use a lot of GAGs to grow. That means that in MPS, the cells of connective tissue fill up with old GAGs much more than other areas. This causes connective tissues to grow larger throughout the body, causing joint stiffness and many other symptoms. This also affects how bones grow. In the arms and legs, bones grow from special areas called the growth plates. Other bones, like the spine, use ossification centers. These areas are made up of soft cartilage, a type of connective tissue, which slowly create new, hard bone through a process called ossification. Ossification begins when cartilage cells start to divide. As more cells divide, they push a stack of cells outward. The cells grow larger and create a hard structure around them, making small pockets for new bone cells to grow in their place. In this way, the bone cells grow in long, organized columns, which make our bones grow in length and their various shapes. But in MPS, the cartilage cells are so packed with GAGs that the growth becomes disorganized. fewer bone cells grow in long columns, and bones tend to grow shorter or smaller. This affects the skeleton in many ways. The spine can be shorter, making the arms and legs longer than the torso. The legs can be knock-kneed, called genivalgum. The hips may be unstable due to hip dysplasia, where the bones aren't as round as they should be. There may be a noticeable hump in the back, called a gibbous deformity, due to an outward curvature of the spine. An MPS can have many effects on the face, some of which are called coarse facial features. In the connective tissues, joints can be large and stiff with a lower range of motion. For example, the knees can be in a crouched position, and the hand can be in a resting claw. However, in MPS type 4A, called Morquio syndrome, joints are looser instead. Large connective tissue can put pressure on nerves, making them not work as well as they should. This can happen in narrow areas like the wrist and spinal canal. Altogether, the effects of MPS on the bones and connective tissues can cause pain, discomfort, a reduced ability to move, and many other symptoms. MPS can also cause problems with the heart, lungs, airway, and nervous system, which need to be seen by specialists like those in our Inherited Metabolic Disease Department. There is no cure for MPS. However, research on treatments is ongoing. Current treatments include enzyme replacement therapy and stem cell therapy, sometimes known as a bone marrow transplant. However, these treatments do not have a major effect on the skeleton. The effects of MPS on the skeleton can be managed by keeping a healthy weight, using assistive devices such as orthotics, a cane, walker, or motorized scooter, or medicines to help manage pain. However, if your child is unable to do everyday activities, or if they struggle with chronic or long-term pain, orthopedic surgery may be helpful in some cases. Here at the Orthopedics Institute at Children's Hospital Colorado, we are ready to help you and your child on their journey with MPS, from before birth into adulthood. Our nationally recognized experts are frontrunners in the latest advancements in research and care, and work with our Inherited Metabolic Diseases Department so you don't have to travel to see different specialists. We are proud to be associated with the MPS Society, a nonprofit that serves individuals, families, and friends affected by MPS, increasing public awareness and supporting research to work towards a cure. To learn more, call us at this number, click the links here, or visit our website by clicking the links in the description below. You can also watch our next video about common orthopedic surgery options for MPS by clicking here, or look for a link in the description.